Good morning, everyone. My name is Colleen Hernandez from CGI Business Solutions, and I'm going to be reviewing the upcoming benefits for the 2019-2020 calendar year. The benefits that we are going to be reviewing will take effect December 1st and will remain in effect until November 30th, 2020. Now, being open enrollment is your time to make any plan changes. The elections that you make right now, again, will not begin till December 1st and will remain in effect throughout the calendar year unless you have a special qualifying event. A few sample events such as marriage, divorce, birth, or adoption are illustrated in the light blue box in the middle of the benefits at a glance that you can see on the screen. I do want to point out that these qualifying events, so you're able to make changes to your enrollment, it does not give you the ability to change the plan that you're enrolled on. So whatever plan you have, you will have to keep. You'll just be able to change who is covered by the plan. So if you're married, if you get married, you're able to bring your spouse on the plan. If you get divorced, you're able to remove your ex-spouse from your plan, but the plan itself will remain the same. So this upcoming benefit year, we were able to keep all plans exactly the same, increase the tele-advocacy package through new benefits, so we're going to talk about a couple of those enhancements, and provided at no cost to you this year are two brand new benefits. One being an employer-paid life insurance benefit in the amount of $10,000, and then another employee assistance program available to everyone, even those that are part-time. Looking at the benefits at a glance, the bottom of the first page is going to be a refresher on how you can find both in-network medical or dental professionals. Under the medical section, you'll notice that the first block is to find a provider within the state of Florida, but directly underneath that, we'll review how you can locate a provider outside the state of Florida. It's going to be www.bcbs.com. Right-hand side talks about how you can find a participating dental professional on the PPO network. Medical, you're allowed to cover your dependent children until age 30. And dental and vision, you're able to cover your dependent children until age 26. If everyone can draw their attention to page 2, we're going to review the medical benefits. Exact same medical plans you had to choose from last year are going to be available again this year. So I did just want to talk about some of the differences between the plans because everybody is able to just read it on their own and follow along. The 5302 plan, you'll notice that this is a copay plan option. So you're going to have a copay when you go to the doctor. You're going to have a copay for the specialist. There's even a copay for the emergency room and urgent care center. So anywhere that you see the word copay, you walk in, you walk out, you pay whatever that copay dollar amount is. If you need an x-ray, advanced imaging, inpatient, outpatient surgery, you're going to be responsible for 30% after you pay your deductible. Deductible on this plan is $5,000 for an individual and $10,000 for a family, not to exceed the out-of-pocket maximum of $6,350 for an individual or $12,700 for a family. If you have family coverage on this plan, one person within your family will not be responsible for any more than the individual requirement of $5,000 deductible, then 30% coinsurance, not to exceed $6,350. And then collectively, as an entire family, You guys will not be responsible more than a $10,000 deductible, then 30% coinsurance until you reach that $12,700 family out-of-pocket maximum. This plan does allow for out-of-network benefits as well as all of the other plans, and it's on the largest Blue Cross Blue Shield network, which is going to be Blue Option. This plan only allows for generic only medication though. So if you take brand name medication, you may want to consider one of the other plans that do allow for brand name drugs. Second plan, again, this is going to be a copay plan. So you're going to see copays for the doctors and the specialists. Deductible on this plan is exactly the same as the first plan, $5,000 individual, $10,000 family, then 30% coinsurance until you get to the out-of-pocket maximum of $6,350, $12,700. This plan, however, does allow for brand name prescription drugs. Couple things that I wanted to point out now that we've moved on to a second plan. That out-of-pocket maximum, you'll notice the first plan and the second plan are exactly the same. That's the worst case scenario amount that you will pay in a given calendar year. It's not to exceed $6,350 on either of those plans. You take your finger and you look at all of the other plans, you'll notice that worst case scenario in a given calendar year, most of your plans, you're going to be responsible for the same dollar amount. How you get there is what's going to be different. On the 5901 plan, this is again is a copay plan. You're going to have copays for the doctors, the specialists. You have a copay for inpatient hospitalization and outpatient surgery on this plan, unlike the other plans, which had called for deductible and coinsurance for those types of services. This plan, you have a $2,000 per person deductible. After the individual person pays that $2,000 deductible, then you pay 50% coinsurance, not to exceed $6,350 for an individual or $12,700 for the family. Again, full drug card on this plan. 5904, another copay plan. Your deductible on this plan is going to be slightly lower, as is your out-of-pocket maximum. As a reminder, wherever you see the word copay, it is a straight copay. Deductible and coinsurance only kick in on the services where you see X percentage after deductible. Plan number 5, going to be the HDHP 316061 plan, right over here. This plan is not a copay plan. This plan works very different than any of the other plans that we've already spoke about. This plan is a health savings account eligible plan. That means that you are responsible 100%, whatever the contracted rate is, for the first $1,350. So you're responsible for everything, including doctor's office, including prescription drugs. You pay everything until you pay $1,350 for an individual. Then you'll pay 20% until you get to your out-of-pocket maximum of $5,000. This plan works slightly differently in how it functions pertaining to the deductible as well. If you have family coverage, Blue Cross Blue Shield will not kick in any money until you meet the entire family deductible. So you're responsible for the first $2,700, and then the 20% coinsurance will kick in until you get to the $5,000 out-of-pocket maximum. Where the other plans, no one person in your family would pay more than the individual responsibility. On this plan, if you have a family coverage, you must first satisfy the family deductible before that coinsurance kicks in. This plan also allows you to have a health savings banking account where you're able to put money tax-free into a savings account to use for future medical expenses. Qualified medical expenses do include dental and vision expenses as well. As a reminder, this plan, you are on the hook for prescription drugs until you satisfy the $1,350. If you're individual, then you'll have a copay of $10 tier 1, $50 tier 2, or $80 tier 3. Next plan option is going to be a copay plan again, the 5301. You'll have copays to see the doctor, copays to see the specialist, emergency room, urgent care, etc. Full drug card. Does anybody have any questions about the medical plans right now? Okay, excellent. We're going to move on to some money saving tips. First, before I get to the next page, I do want to just point out a couple things. Number one, if you look the urgent care center, wherever there is a copay for urgent care center versus emergency room, you'll notice a significant savings. So on plan one, the 5302, you have a $60 copay for the emergency room. However, you have a $60 copay for urgent care. However, a $300 copay for emergency room. So who would rather pay $60 over $300? I know I would. An urgent care center is great for minor emergencies, such as you need an x-ray, you need stitches, you're really sick, you can't get an appointment with a doctor. However, if you are having chest pains, you pass out, please go directly to the closest emergency room, because an urgent care center will send you to the emergency room anyway. The line item above emergency room is going to be convenient care clinic. You'll notice that that is going to match the primary office copay, but it's available with a greater range of appointment times. So these convenient care clinics are popping up in Walgreens, CVS, and you're able to pay whatever your primary office visit copay is. However, they do have evening and weekend appointments. Also, you should have received a card for the Teladoc benefit, where you and whoever is enrolled as your dependent on your medical plan are able to virtually meet with a medical doctor 24/7, Skype, FaceTime, online, or over the phone. Those are going to be great for if you think you have pink eye, maybe you have a sinus infection, a rash on your arm, you're able to go on ahead, FaceTime with a doctor. If you need a prescription, they can call a prescription over, and it could be ready in your pharmacy before you even get there. All of the plans, except for the Blue Options HDHP plan, 316061, located in column 5. If you use Teladoc, you're going to have a $10 copay on the HDHP plan. Remember, you're not going to see any copays, and you're going to pay 100% up until you get to your deductible. Well, the contracted rate for the Teladoc services is about $40 on this plan. Any questions about this so far? Perfect. If we take a look at page 3, page 3 is going to be another way to help you guys save money. Publix over here in Florida offers free antibiotics as well as some routine maintenance medication, so it is quite possible that other pharmacies locally do the same. Nationally, we have Walmart and Winn-Dixie stores that have a discount generic program where you can get $4 for a 30-day supply or $10 for a 90-day supply. All of these prescription savings tools that we're talking about now, you actually do not even need insurance in order to take advantage of. All you need is a prescription. GoodRx is a website that has been really getting some notoriety the last couple of months. I'm seeing commercials on TV now. It's a website that you're able to type in the name of the medication that you take as well as your zip code. It'll tell you pharmacies in your area that have the medication, and if there is a coupon, you will have a link directly to that coupon. Last option that we have to talk about over here regarding prescription discounts is the Canadian pharmacy. You're able to purchase medication from the Canadian pharmacy. However, the medication that you were to purchase would not be credited to your medical deductible out-of-pocket maximum. However, you could see up to 70% savings off some of the name brand medications. Looking back at page 2, we spoke of that high deductible health plan, the 316061. If you elect that plan, I mentioned how you were able to open the HSA banking account. Money that you put in that account is tax-free and able to use for qualified medical expenses. The limit you're allowed to put in is going to be $3,500 if you're enrolled with employee-only coverage, or up to $7,000 if you have employee family coverage for the 2019 year. Anybody over the age of 55, you can also save an extra $1,000 to use for qualified medical expenses, which again includes things such as dental and vision, not only medical. Please keep in mind, though, that this does work like a bank account. If you don't have the money available and you swipe your card, it will be denied. This also works like a bank account, though, in the sense that if you were to leave the employer, the money comes with you. It is your money. Any questions about anything we've spoken about this far? Page number 4, Florida Blue has some locally owned doctors called Clinicinitas, and you have the option of seeing them within Florida, and you're able to get discounted pricing, some as little as $5 per visit. Brand new, starting 10/1/2019. So if you are on the plan already right now, you can still take advantage of the Teladoc benefit. It's going to be $10 copay if you're on any of the copay plans, or about $40 if you're on that high deductible health plan, 316061. 24/7 access to those actual real life U.S. board certified medical doctors. This year, we are going to be offering an enhancement. The new benefits package that you currently have is no longer available. It has been enhanced and replaced with the Tele-Advocacy, Healthcare Navigation, Financial Wellbeing, and Pet Care package. This package, if you choose to purchase it, is $6.23 per paycheck. The benefits cover you as well as any of your tax dependents. This benefit has Teladoc built into it at no member responsibility. What this means is if you are on the Blue Cross Blue Shield medical plan provided to you by GBS and you purchase this new benefits package through new benefits with Teladoc, instead of paying $10 if you use the Teladoc through Blue Cross Blue Shield, this one is going to be free. You do not have to pay anything. Also, the new benefits Teladoc portion will cover you and all of your dependents, even if they're not enrolled on your medical plan, where Blue Cross Blue Shield says you can use the Teladoc that we provide to you you're going to have to pay, and we're only going to cover it for anybody that's covered on the plan. Me, I cover myself and my children on my medical plan through Blue Cross Blue Shield. Me and the kids could use Teladoc, and I have to pay for it every time I use it. However, my husband, if I had the Teladoc package through GBS, I could have my husband, my kids, and myself all use this, even though my husband's not covered on my Blue Cross Blue Shield plan, and I wouldn't have to pay when I use it. Plus, the Teladoc is only a very small little piece of what's available in the entire package. The package also comes with pet care, where you're able to get discounts on veterinarian services, food, doggy daycare, prescriptions for your pet, etc. Also, you have discounts for alternative medicine providers. A lot of people are taking a more holistic approach to their medical and look for additional means such as acupuncture. They're not jumping straight to prescription drugs. Instead, they're looking for some herbal remedies, and you're able to get discounts at participating providers up to 3%. The other brand new piece of the package is the compass navigation piece. This piece, they're able to do a variety of things. If you are diagnosed with a condition, they're able to call providers, make appointments for you. You say, hey, I need an appointment Tuesday at between the hours of 3 o'clock and 5 o'clock. They can call around different providers participating in your network until they find a specialist that fits into that time slot, and they can make the appointment on your behalf. Also, if you get any medical, dental, or vision bills in the mail, you can send it on over. They can review and advise if the amount due is correct. Plus, like I had said, if you were to get a diagnosis of a certain condition and a doctor suggests that you have surgery, for example, hey, looks like you have carpal tunnel. I think that you need to have surgery. Here you go. You can call up Compass Navigator, and one of the trained navigators, they can do a little research on the internet for you. So it's going to save you some time here, and provide alternatives to surgery. Number one, it's just education, so it would be exactly what you would be able to find out yourself if you were to take the time to go online. They're going to go online for you, do the research, provide it to you. You can review it, and then have an educated conversation with your doctor. Maybe I take it back and say, I would really like to try physical therapy for a couple weeks. It seems like this has been, a great tool for some other people, and I'm so sorry. And I would like to try physical therapy before I jump to surgery right away. They can help you find the best rated surgical centers in your area that are participating in your plan if you wanted to jump straight away to surgery. I mean, they're just essentially there to help you with all of your medical, dental, and vision needs. If you are on the medical, dental, and vision plans provided to you through GBS, Compass Navigators, they're going to have all your information already in the system. They can help you with everything because I'm going to be providing it to them. Any questions about the benefits we've discussed thus far? Okay. Page number 7 talks a little more detail about some of the things that the Compass navigation piece of the new benefits package is able to do. Looking at page 8, these are instructions on how you can download the My Benefits Work app. This is going to be the app that covers the entire new benefits teleadvocacy package, the Teladoc, the pet care, the alternative medicine, the discount on the prescriptions, the Compass Navigator piece. However, I do want to point out that once you register for the My Benefits Works website and you click on the Compass Navigator icon within your My Benefits Work app, you will have to re-register for the Compass portion, but you can use the exact same user ID and password, but the My Benefits Work is taking you to a separate Compass navigation site. So that's why you're going to have to register again. I was able to register online. I was able to download the app on my phone and complete my medical questionnaire for the new benefits portion in under 10 minutes. And that was completing for me and 3 children. So I just mentioned the new benefits questionnaire. Just like you were to see any new doctor for the first time, they're going to need to know your health history. So whether it be the teledoc through Blue Cross Blue Shield or the teledoc through the new benefits package, I would just suggest that you register online prior to needing the service and take a couple minutes and fill out that medical questionnaire so that when you're not feeling well and you're ready to use the benefit, you don't have to take the time to do so. Page number 9 will review your 2 different PPO dental plan options. Both the dental plans are through Guardian. You'll have the base plan or a buy up plan option. Base plan is going to have a $50 individual deductible in network. Out of network, it's a $100 individual deductible. Preventative services, you're going to pay nothing in network. Out of network, you're going to pay nothing after you meet your $100 deductible. Basic services such as fillings and a simple extraction is going to be covered at 20% after deductible in network and then 50% after deductible out of the network. Major services such as root canal, periodontal scaling, and root planting or crowns are going to be covered at 50% after your deductible, and out of network, you're going to pay 75% after your deductible. This plan does not have orthodontia available. The buy-up plan is going to have the same $50 individual deductible both in and out of the network. In or out of the network for preventative services, you're going to pay nothing. Any basic services in or out of the network, you're going to pay 20% after your deductible. Plus, we've now taken the root canal, which on the base plan was covered as a major service, and moved it to basic. So instead of 50% after deductible on the base plan, a root canal will be covered and you'll only pay 20% after your deductible. Crowns and all other major services, you're going to be responsible for 40% after your deductible. And on this plan, you do have child orthodontia available. Both of the plans provide you with a $1,000 calendar year benefit. That is the dollar amount that Guardian will pay on your behalf. However, GBS has been offering Guardian coverage for the last few years. So it is possible that somebody may have a different calendar year benefit because Guardian rewards good dental hygiene. And if you had the dental in past years, received some kind of care and treatment that did not exceed $500 that Guardian paid on your behalf, Guardian is going to reward you anywhere from either $250 if you're on the base plan or up to $350 in network on the buy-up plan as a reward for taking care of your teeth. Any questions about the dental plan? Next plan we're going to talk about is the vision. I'm so sorry.
Found out they don't cover dental implants.
They do not cover dental implants?
No.
Okay. Correct. I'm sorry. I thought that was a question.
No, that's just a statement.
Correct. So an implant, you're going to be on the hook for, except if it's like a crown, which some people consider an implant, but no, like a fake tooth itself, not covered. However, dentures there are going to be covered on the plan.
Correct. I had both crown and an implant. The crown was
Okay.
covered.
Yeah. Moving on to the vision section. Vision benefit is still offered through Guardian. However, there is a change to the network of providers. Currently, we are on the Davis Vision Network. We are moving to the VSP network come December 1st. The VSP network is going to allow for more individual doctor practices, and you're still able to get some of those changes, including LensCrafter now, which was not available under the Davis Vision plan. You're going to have an eye exam every year, new lenses or contact lenses every year, and new frames every other year. Just like on the Davis Vision plan, still going to receive the $130 allowance for the frames or contact lenses, $10 copay for the eye exam, $25 for the lenses, just like on your Davis Vision plan. Questions about the vision? For every single member enrolled in the dental plan, you get a college tuition benefit. This is absolutely free, but you must register in order to take advantage. The college tuition benefit is provided through Guardian and will give you 2,000 points every single year, and then an additional 500 bonus points for every dependent that you enroll. Those points, for every point, equals $1, and that money can be used towards your qualified beneficiaries' college education. There are over 400 now participating colleges, and the colleges, they just increase in number every year. Those are private schools, though, so they are a little bit more expensive. So start earning those points right now. Qualified beneficiaries are going to be your kids, stepkids, grandkids, nieces, nephews, godkids. So essentially, as long as you have their name and date of birth, you're able to register them for this site. The more kids you register, the sooner you register, the more money you're going to be saving to use towards a qualified dependent's future education. The next benefit is the accident benefit. This is a benefit that pays you directly a lump sum in the event that you're injured due to an accident. If you are hospitalized, you're going to get a $1,000 benefit. However, that hospitalization has to be a result of an accident. So if I have pneumonia and I go to the hospital, I am not receiving that benefit because it was due to an illness and not an accident. And again, this money is paid directly to you. You can do whatever you want with the money. You can use it to pay your hospital bill. You can use it to go on vacation, plan a trip, buy a new TV, whatever you want to do. The money is paid directly to you. The amount that you get is going to depend upon where you seek care and treatment and what care and treatment you need as a result of that accident. Also available is the critical illness benefit with a cancer rider. This again is going to pay you a lump sum in the event that you are diagnosed with a critical illness and or cancer. The $10,000 benefit for an individual. If you elect spousal coverage, the spouse gets $5,000. And then all children will get a $2,500 benefit free of charge. However, if you do not enroll your children on Employee Navigator, not going to know that you have kids that could be covered if you have this benefit. No additional cost for the children, but I need their information, otherwise they're not going to have it. On this benefit, if you decided in the past that you did not want it and now you would like to take advantage of it, you will need to complete an evidence of insurability form, which will be found on Employee Navigator. Short-term disability is a great benefit offered to you through GBS as well. It's able to supplement the loss of a paycheck due to an accident and or injury. So the short-term disability is going to kick in the event that you're disabled and unable to work. You're able to get up to 60% of your salary for 12 weeks. The rates are available on Employee Navigator. It's going to depend upon the salary amounts, the benefit that you're able to receive. So it's 60% of your salary, and also based upon your age. Next is going to be a hospital indemnity plan. There's 2 different plans to choose from. It will help cover your expenses in the event that you are hospitalized. Brand new this year is a $10,000 employer-paid life insurance benefit. This benefit is available and offered to absolutely every single individual that is working 30 or more hours a week. You must choose a beneficiary, or the money, if God forbid, will go to your estate. In the event that you would like additional life insurance, you will have the option to purchase it for both yourself, your spouse, and your dependent child. Rates are going to depend upon the age and the amount that you choose. If you declined insurance in the past and now you would like to enroll, or if you would like to enroll for the very first time where you've declined in the past, or if you are brand new and eligible right now and elect more than the guarantee issue amount, you will need to complete an evidence of insurability form, which can be found online at employeenavigator.com. Also, another new benefit being offered is the Employee Assistance Program. This benefit is offered to every single individual working for the company, even if you are part-time. The Employee Assistance Program is able to assist with all aspects of an employee's life. It's able to help you find child care, help you to find elder care, senior centers, debt management. My child, when she was 12, entered middle school. Boy, little girls can be very mean. We were able to get unlimited telephonic help, so she was able to talk to somebody over the phone as many times as she wanted, get 3 free face-to-face sessions with a licensed counselor free of charge. All the calls are strictly confidential, so neither myself nor GBS will know that you are calling nor what you are calling about. Absolutely free, something available to everybody, so please take advantage. Any questions about anything we've talked about so far? Okay. Last benefit available to GBS employees is identity theft. Identity theft is offered through LifeLock. Commercials are popping up all over the place, so I'm sure you guys are aware. This benefit is going to prevent or lessen the likelihood that somebody compromises your identity. However, if somebody was able to get access to your bank accounts, your credit cards, open an account in your name, etc., LifeLock will provide up to $1 million rectifying and fixing and getting everything back in order for you. I will need absolutely every single employee to go online and either elect or decline coverage. Website is employeenavigator.com. The screen is going to look like this. You're going to click Login. If you have already registered, you're going to enter your username and password. If you forgot what your password is, you're going to click on the link right over here that says Reset a Forgotten Password. You will then receive an email with a link to reset your password. If you have never registered for the site, you're going to click on Register as a New User, and your company identifier is going to be GBS space ENT, all caps, and it is case sensitive. Once you log on to the website, it's going to take you to a screen that looks like this. You're going to click on Start Enrollment, get started, and it's going to take you screen by screen to all of the different benefits that we've just reviewed. Second. The dependent information, this is where you would add any of your dependents, and then talking about all the different benefits here with all of the rates. And on the right-hand side is going to be more detailed information about all of the plans. On the top right-hand screen is a little My Selections. It's going to tell you what you are currently enrolled in. So this demo employee was currently enrolled in the 5904. So if everybody could please have that completed, the sooner the better. We are shooting for completion by Friday so that if you're making plan changes, enrolling in a new plan and or benefit, you'll have ID card in hand by the effective date. Just with the holidays coming up, you have Thanksgiving, and it just mail moves a little bit slower, as do all of the carriers. Bottom section is going to be the contact information. You're going to have the website and telephone number for all of your different providers, including at the bottom information for both Debbie and myself. Most important thing is where to find the answers, not knowing the answer. Does anybody have any questions at all regarding any of the benefits? Again, both Debbie and myself were able to help you. If you have anything, please don't hesitate to give us a call. Thank you very much for your